In November, Matt Gagne wrote a piece on the Pine Tree Politics concerning the so-called Republican litmus test.
Yeah.
And in that piece, he mentioned you and some of the flack you'd received for attending a healthcare rally and some other positions you'd taken. I'd like to read you a quote from his piece and then get your thoughts on it. By simply showing up, and he's speaking about the healthcare rally, by simply showing up, he apparently implicitly agreed to the entire Democratic agenda on other issues as well. Immediately afterward, it was said that, obviously Peter Mills isn't a true conservative. Kill me now.
That's ridiculous. Listen, if you've got a brain in your head, you have to understand two things about the American economy right now. One is, we have the highest healthcare costs in the world. Our costs are around 16 to 17% of GDP. The rest of the world is doing it for 10%. That means that the American economy is paying a 7% sales tax for everything that we produce in America, every service, every movie we make, every car we make, every product we make. And some people will say, well, it's the fault of the Democrats will say, oh, it's all the fault of the insurance industry. Well, I'm not one of those people. General Motors they were self-insured.
Right.
And they went down the tubes trying to spend $1,500 per car for health benefits for their employees and their retirees. So we've got a generic problem across the board, and it's the states that are going to have to step forward and solve it, no matter what they do in Washington. So when I show up to say to somebody, I think healthcare in America is a serious problem, I don't expect that to be a partisan statement of any kind. That's an expression of the truth. And if you don't understand that truth, you don't belong in politics, you don't belong in public policy, because it's an indisputable truth. And one of the biggest reasons I want to be governor is because I would like to initiate some policies and pilot programs that will begin to get us out of the fee-for-service system that is corrupting the delivery of health care in Maine and the rest of America, and get us to delivering health care in a way that will be much more effective and less costly. Because if Maine can figure out how to do this, we will be leading the rest of America out of this swamp that we're in.
So is this need for some to categorize a politician as conservative or liberal, is that just a distraction, really?
Yeah, if you don't have if you're running for public office at any level, and you don't have a policy, a position on bringing down the cost of health care, then you don't belong in politics, because it's the #1 problem in America right now. It is a significant threat to the economic security of our nation. It is one of the biggest reasons we're having trouble competing with China for manufacturing, or with Canada, for that matter. I mean, and I'm not promoting any of these other systems. All I'm saying is that those costs have to be brought down. My criticism of the bill down in Congress is that it doesn't do enough to bring these costs down. And frankly, if there had been a couple dozen Republican senators involved in the creation of that legislation, it would have had a very different shape, and it would have been a bill that addresses costs effectively. So the bill that the Democrats were allowed to create all on their own is not all that effective. I'm not happy with it.
Well, let's go right in and talk about Dirigo Health then.
Dirigo Health has proven it has proven to many people why a highly subsidized system to provide health insurance to people is not economical, particularly for a poor state like Maine. And Massachusetts, which is a much wealthier state, has tried something vaguely similar and found that they can do it, but that it's immensely costly. So Massachusetts